So stress is normal. Stress is when your body and your brain are going through something which is outside your comfort zone. That is stress. Stress is good for you.
Stress is good for us.
Stress is good for us because if you don't go out of your comfort zone, how will we grow? So if you are not stressed at all in the day, either you are on vacation or you are not growing. So you should be stressed for some time in the day.
Stress is a normal phenomenon.
Stress is a normal phenomenon. Now, fatigue is also normal when you are tired. So you work, eventually your body and your brain run out of resources, run out of fuel. So you start feeling fatigued. When you are fatigued, that is a sign that you need rest. If you are fatigued and you don't rest and you keep going, that is when you get burnt out. Burnt out does actual damage to your body. When you're burnt out, you don't just need rest, you need recovery. Burnt out is a disease. Burnt out means you actually need to go through treatment to come out of it. Fatigue does not need treatment. Fatigue only needs rest.
I see.
So this is the difference between these three terms.
Wow. As a patient, how do I know that I am fatigued versus burnout?
The most important thing is to know your own body because it is not about how much work you are doing. It is about how much work is your body capable of doing. So a good example is, say, if you are going to the gym, on day one, lifting 10 kg for 5 minutes will fatigue you. But if you keep working out, after 3 months, you can lift 50 kg also and you will not get fatigued because now your body is used to that. It is very similar in your brain. How much hard work you're doing, how much hustling you're doing, the more you do, the more you get used to it. So your fatigue capacity increases. But the signs of fatigue is the same for everybody. Fatigue happens, your body tells you when it is fatigued. It starts giving you signals of pain. It starts giving you signals of tiredness. So your motivation levels start dipping. That's because your dopamine levels are falling and your heart rate can be high. So that is a sign that your body is in sympathetic state. So sympathetic state is when your body is in fight or flight, right? So you have to start listening to your body. And whenever you are going into fatigue, you should know that, okay, now it is time to rest. It does not mean giving up. The problem that most people is that they think rest is giving up. But resting is not giving up. Resting means that you will rest and come back and do this even better tomorrow. So those signs that the body gives you, if you listen to it, then you can rest and come back and get better at it.
And burnout is you cannot even come back.
Yes. So burnout is the psychological equivalent of a fracture. So when you are lifting a weight, if you're simply tired and you put the weight down, that is fatigue. But if you keep pushing, at some point your muscles can break or your bone can break. That is burnout in psychological terms. If you're going to your job and your boss is shouting at you, it is stress. And you are constantly working, it's not working out, you are getting more and more stressed, you start getting fatigued. And if you still push through it, eventually there is a psychological fracture that happens. That is burnout. Then you cannot just go back to work the next day. You have to take a full break. You may need to go to therapy. You need to understand what happened with you. How can you set your boundaries? Then come back. Because if you start working out with a fracture, you will do so much more harm. That's why it's very important to recognize burnout.
Wow. There is a common term, physician burnout.
Yeah.
Which is not even heard in India. People think...
What is this alien concept?
What is the alien concept of physician burnout?
No.
Physician burnout is something normalized in India.
Absolutely.
But in the US, at least people are talking about it. And I'll tell you my example. Okay, so I'm practicing gastroenterologist in the US. I start my day at 7 a.m. and then I finish my day at 7 p.m. And then back to back, as soon as I go into the hospital, every time there is something I have to put down. Okay, I see patients, do procedures back to back, finish the documents. I come by 7 p.m. I'm still not done sometimes. Okay, there is documentation to be done and everything. And once I come back at 7 p.m., I have 2 little kids, no help in the US. I have to take care of them. I want to be a good husband to support my wife. This is a very high demanding thing. Okay, so I kept on doing this. Okay, and then I figured out that initially I was fatigued. Then I was burned out. It was very clear. Okay, very clear. So environmental support is also very needed, because in my case, my wife was the one who found out that I got burned out. Is that something that you've seen?
Absolutely. I feel people don't fully appreciate what medical residents go through in this country. Outside of the medical community, I don't think anyone knows what kind of torture medical students go through. So as a medical resident, I now think of how crazy that was.